Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine. We're going to continue our lectures on our videos on physician mistake, which has huge impact on our lives. Patients' lives affected, our lives affected. Huge emotional toll, right? You can't go to sleep. Some physicians have committed suicide. And then what happens is the lawyer is going to come after you. Whatever money you earned is going to go to zero. Okay, so please pay attention to. Everybody make mistakes. Please do understand that. Okay, we are humans. We are prone to make mistakes. And if somebody told you, "Oh, I'm the greatest physician. I never made mistake in the life," please don't believe that person. Okay, humans are prone to make mistakes. Computers don't make mistakes. But the whole purpose of this talk is to make sure so we recognize some of those common mistakes we make and trying to learn from those mistakes. Okay, so today we're going to talk about a case end up in a lawsuit, and the payment was around $217 million were given to the patient's family, and that's about cerebellar stroke. Okay, not that everybody diagnoses pretty much the other common stuff. This patient came with nausea, vomiting, dizziness, and diplopia, and the physician did a CT scan, but they did not diagnose the cerebellar stroke. Okay, now the mortality in cerebellar stroke is extremely high compared to regular stroke. And the other thing is cerebellar stroke. There is a role for neurosurgery in cerebellar stroke. It can develop cerebral edema, and then herniation can happen. So it's important when a patient came in, let's look at what are the symptoms usually presented, okay? Coordination dysfunction, dizziness, balance dysfunction, muscle weakness, difficulty chewing, diplopia, headache, nausea, vomiting, and loss of consciousness. So diplopia, dysarthria, dizziness is the most common, like 70% of the symptoms. Anytime patient come to the emergency room dizziness, please make sure you rule out cerebellar stroke, okay? The next thing you have to do, like you look for the physical examination, you look for the cerebellar signs, like finger to nose to test, right? And the test for the gait. And all of this is kind of important, so we know there's something going on in the cerebellum. Now, please remember, CT scan is not going to pick it up because it's in the posterior fossa. You need an MRI of the brain. If you don't get an MRI like right away, by the time you come back, there's going to be like edema build up, and then a patient is going to herniate and die. Okay, so again, this is the only, this is the stroke pretty much you have to think about. There's a role for surgical intervention, neurosurgery, because they can do a ventriculostomy or like shunt, to relieve the pressure in the posterior fossa. Okay, so always remember, the diagnosis, if you, everybody's going to get a CT and CT angiogram, but don't forget about the MRI of the brain in the posterior fossa, and the role, you can do the regular TPA and all that, but again, you have to worry about the posterior fossa, swelling. Neurosurgery has a role in it. Thank you so much for watching. We'll do more presentation like this. Please subscribe to our channel. Thank you again. God bless.